Hi friends, I am Dr. Anshul Bansal again joining you on this Unacademy platform. As you all know, I am here to teach you orthopedics, and here we'll study in-depth orthopedics so that not only you can crack your NEET PG, INI-CT and other competitive examinations, but also your university prof examinations and your next examination. Today's class is focused on NEET PG 2021, that is on 12th September. Only 5 days are left. Okay, in today's class we'll study about all the x-rays of the lower limb. So it will be a rapid revision type of class जहाँ पे अपन x-ray देखेंगे and उन fracture से related जो important चीजें होगी I'll just tell you, but basically it's for the x-ray identification wali cheese. Okay, and very important, it is a rapid revision session. So let's start it. And before starting today's lecture, I will briefly guide you through our various subscription plans that are available on the Unacademy for the NEET PG. And the first one is the Plus subscription. The Plus subscribers would get the access to all our live as well as our recorded sessions, all our QBanks. They can participate in live tests and quizzes, all of which are formulated by the topmost faculty for NEET PG in India. And also you can log in with the same account on multiple devices so that you can study on any device of your choice at any time. And also for the subscribers of 12 months or more, we'll be giving them printed notes shortly, and you can use this code while subscribing for the course to get extra 10% off. The second one and the best one is the Iconic subscription. It is best not only on Unacademy but on any digital platform across India. Apart from the things that I have mentioned earlier, in Extra May you will get the Prep Ladder and all of the Prep Ladder, including its QBank, the video lectures, the rapid revision courses, the grand test quizzes, everything you will get. And on Unacademy Extra May you will get well structured live batch wise classes, and we have formulated our batches as well as our course schedule in such a way so as to build your basic concept about every subject first and then going into it in depth. And also we'll try to correlate the same topic with the different subjects so that it will be helpful for your better understanding of the subject and your revision point of view. And also the Iconic subscribers would get their individual assessment after every test so that they can analyze themselves, they can analyze the test they have given, they can find the lacunas or the areas in which they need to work harder. Okay, so you can use this code while subscribing for the Iconic subscription to get extra 10% off. The next is the special class feature. As you all know, special classes are very special because it gives you live classroom like feeling. In COVID times also they are very interactive session where you can interact with your educators, clear your doubts there and there only. You can participate in the polls. You can also watch the lecture anywhere anytime by just logging to your mobile application. For that you just need to download the application and subscribe using this code, both of which are absolutely free. Okay, and these classes gives you extra edge over other students. So please log into your Unacademy app and see the special classes. Now, keeping in mind the various students which are opting for different sets of examination, or their goal is different sets of examination, like for some their goal is FMG or next examination or the 2022 NEET PG or this year's NEET PG. So dedicated to these students we have started a dedicated batches for the following, and you can subscribe to these courses using this code to get extra 10% off. And for the FMG we have already started a batch from 8th September, and for the next 2022 we have also started a 6-month duration course from the 8th September, and you can subscribe for these courses. And for this year's NEET PG, we had formulated a 1 month special package, and this package has everything. Personally speaking, also this is the best on any digital platform, because here you will get everything that is needed for the last time preparation, the last minute tips and tricks, the high yield MCQs, the high yield topics or the subtopics, the recent advances, or the image based, the slides, X-ray, clinical scenario based questions, the very important grand tests, and the live quizzes, the rapid revision, etc. Everything you get in this package, and you can use this code to buy this package and get extra 10% off. Okay, now for the students who will be subscribing for 12 months or more, we are running a limited time period offer, in which if you'll buy any subscription of 12 months, you will get 2 months of that free, and if you buy any subscription of 24 months, you will get 4 months of that subscription absolutely free. And for our MBBS students, we have started a 4-year subscription course, and we are giving a heavy discount right now, in which the iconic subscription is available for just 75,000 for the entire 4 years, and the plus subscription for 60,000 for the entire 4 years. And during subscription, you can use this code, that is Anshul B10, to get extra 10% off. Okay, of the plus as well as the iconic available. And as you can see, the per month cost of the subscription decreases significantly if you increase the number of duration of your subscription. So it is economically feasible, as well as keeping in mind the next pattern. The MBBS students has PG examination from the word go of the MBBS, and the very important is to keep a single source of information. Naya source of information, if you will try every time, it will be very difficult for you to learn. So I would recommend to go for the Unacademy subscription package of longer duration of months, because ये economical भी है, दूसरा it is the best, so you don't need to change your source every time, and you can subscribe for these courses and packages using this code to get extra 10% off. Okay, so let's start today's session. I know your time is very valuable right now, so let's crack NEET PG with Unacademy. Okay, so in the lower limb, सबसे पहले we'll study about the pelvis, and in the pelvis, surface anatomy of the pelvis is very important. First of all, this is X-ray bilateral hip with pelvis AP view. Okay, pelvis के 3 parts होते हैं. This is your ilium, this is your ischium, and this is your pubis, and these 3 bones make the pelvis bone, or ox coxae भी बोलते हैं इसको. This is your femur, head of the femur. This is your acetabulum. Okay, this is your acetabulum forming the hip joint. Okay, here this is your anterior superior iliac spine, that is ASIS. Here is your, these are your sacroiliac joints. This is your iliac blade or the iliac wing. Okay, now this is your pubic symphysis, very important. Now this is your ischial tuberosity, and here this will be here, there will be your ischial spine, there will be your ischial spine. This is your pelvic inlet or the pelvic ring. Okay, and here is your acetabulum, and acetabulum ke bhi there are 2, in acetabulum also have 2 columns, the anterior column, okay, the anterior column and the posterior column. So the anterior column is the ischiopectineal line, and the posterior column is your ilioischial line, and the anterior column is your iliopectineal line, not ischiopectineal, iliopectineal line. Okay, so here you can see this this is your iliopectineal line, that means this is your anterior column, and this is your ilioischial line, this is your posterior column. Remember this, ये सारी surface markings are important for you. Here you can see in the diagram also, yes, यहाँ पे these are the superior pubic rami and this is your inferior pubic rami. Okay, and this is your obturator foramen, we have already discussed. यहाँ नीचे ischial tuberosity होगी, ऊपर ischial spine होगा. Okay, this part is your greater sciatic notch here. Okay, here this part will be your greater sciatic notch. Okay, this part is your greater sciatic notch. Okay, so this is the normal X-ray anatomy of the pelvis, very important for you. Now नेक्स्ट pelvic fractures जो होते हैं, pelvic fractures are divided into type A, B and C, and this classification is called as Marvin-Tile classification. A is stable, B and C are unstable. Okay, and B is rotationally unstable and C is rotationally as well as vertically, यानी and इसमें भी vertically is more important. यहाँ पे you will have isolated fracture in type A, and most commonly is the SPR fracture and the IPR fracture, and these are the most common fractures of the pelvis also. Okay, and here you will have the open book fracture where you will have the pubic symphysis में gap अगर more than 2.5 centimeter है, then you have to go for the surgery by the external fixator or the internal fixation. And open book fracture में pubic symphysis में gap increase हो जाता है, and that is called as the pubic diastasis. And that is called as the pubic diastasis. Important, remember this. We'll see the X-ray. And type C में आदि worst prognosis वाले होते हैं, they are the worst prognosis fractures. Okay, here you can see this is your isolated fracture of SPR. So this is your type A, and type A Marvin-Tile classification में type A. Here you can see this is your diastasis, the pubic or pelvic diastasis, and this is your open book type due to the rotational injury. Okay, and due to the rotational injury, so this is your type B. And here you can see this is your vertical compression plus rotation की वजह से there is the open book plus there is iliac blade, acetabulum, IPR, बहुत सारे fractures है due to the vertical as well as rotation. So this is your type C वाला fracture of the Marvin-Tile. And you have to check for two things in every pelvic fracture. सबसे पहले the hemodynamics because of increased blood loss, and the second is you have to check for any urological injury like urethral or the bladder injury. Okay, remember this. What is this? This is fracture of anterior superior iliac spine, very important. And see, this is fracture of acetabulum. What is this? This is fracture of acetabulum. And here you can see there is an important sling which is used for the treatment of pelvic fractures, especially the pelvic diastasis, and this is called as hemlock sling. Okay, this is called as hemlock sling. नाम and photo याद होनी चाहिए. And this is your external fixator assembly used to treat the pelvic diastasis like this. And यहाँ पे the pins that are used, these pins are called as the Schanz pins. Okay, these pins are called as the Schanz pins. Okay, now two things. यहाँ पे medial surface पे just near the LT there is a vertical bony prominence. Okay, that is called as calcar or the calcar femoral. It is a landmark during the surgery used by the surgeon. So this is your calcar femoral. This you need to remember. And in the femoral head there are trabecular systems. There are two: the medial trabecular system, which are the compressive ones, and the lateral trabecular systems, which are the tensile ones. And here is a zone of weakness. So neck of femur may there is breakage or the rupture of these trabecular systems. Okay, remember this, important. Okay, now coming to the dislocations of the hip. Hip dislocation में the most common is your posterior dislocation of the hip. And in posterior dislocation it is due to the dashboard injury, because a एंटीरियर पोस्टीरियर फोर्स लगेगा तभी पोस्टीरियरली डिसलोकेशन होगा. तो डैशबोर्ड इंजरी एंड द presentation of the lower limb will be a adducted, flexed and internally rotated, and opposite will be in the anterior dislocation, where the leg will be abducted, extended and externally rotated. And posterior में adduction, flexion, internal rotation के साथ में there will be shortening of the limb, whereas in anterior dislocation there will be lengthening of the limb. ओके, इम्पॉर्टेंट है, ये ध्यान रखना है. और कोई सा भी डिसलोकेशन हो, द ट्रीटमेंट ऑफ चॉइस इज बाय क्लोज्ड रिडक्शन. द ट्रीटमेंट ऑफ चॉइस इज do first close reduction under GA, then maintain it by immobilizing or the traction. In this case we'll use the traction. So this is your treatment of choice. Here you can see flex, adducted and internally rotated posture with head of the femur dislocated posteriorly. So this is your posterior dislocation of the hip joint. And इसके लिए the techniques that are used for the close reduction, उसके name आपको याद होनी चाहिए. And these are Bigelow's maneuver and Watson-Jones maneuver. Okay, just remember the names of these two. And here you can see, अगर intra-articular fracture है like the central dislocation, तो यहाँ पे surgical treatment is the treatment of choice. And in acetabulum fractures or intra-articular fractures, or due to other causes, there can be secondary osteoarthritis and or the AVN or osteonecrosis. So this is your AVN of right hip joint. Okay, ये ध्यान रखना कि the thing that you'll see in the left side will be the right on the x-ray will be the right side of the body. Okay, so this is your AVN of the hip joint. So AVN में ये याद रखने वाली बात है, you have the Fickett and Arlett classification, very important, and also modified Fickett and Arlett classification called as the Steenberg classification. Both are important. And इसमें type 1, 2, 3 and 4 में divide किया है. Type 4 में there will be osteoarthritis involving the cartilage and the entire joint. Type 3 में very importantly you will see the crescents. Okay, तो crescents जो मिलते हैं that you will see in type 1, x-ray will be normal. And in type 2, what you will get in type 2, you will have subchondral cysts and sclerosis, etc. There you can see the head of the femur is collapsed with involvement of the acetabulum and the joint space. So this is type 4 Fickett and Arlett classification. So AVN is very important, also called as the osteonecrosis. Okay, here you can see this is your anterior dislocation of the hip, क्योंकि फीमर का हेड एंटीरियरली डिस्प्लेस्ड एंड दिस इज योर सेंट्रल डिसलोकेशन और द सेंट्रल फ्रैक्चर डिसलोकेशन ऑफ द हिप जॉइंट. ओके, now what is this is your fracture neck of the femur. So सबसे पहले we have to differentiate between the fracture neck of the femur and the fracture intertrochanteric femur, that is IT femur. So neck of the femur neck में होगा and IT femur greater and lesser trochanters जो होते हैं उसके बीच में से जाता है, that is your IT femur. So the neck of femur is your intracapsular whereas this is capsular, so it is intracapsular. So the fracture is within the capsule, so obviously it will be, the displacement will be less. Whereas in IT displacement will be more. The signs and symptoms will be less, the signs and symptoms will be more. दोनों ही elderly population में with trivial trauma होता है. AVN के चांसेस बहुत बहुत ज़्यादा होते हैं, इट इज़ वेरी लेस. एंड द IT femur fracture unite always, and they almost never unite, or there are high chances of non-union. So non-union will never be a complication of the IT femur. The treatment of choice of the neck femur is your surgery, whereas in IT femur you can go for the conservative management also. Okay, now firstly अपन पढ़ेंगे neck of femur fracture. So neck of femur fracture जो होता है, the classification होता है neck of femur fractures का, it is classified into three तरीके से. The first classification is based on the anatomical location of the fracture line. So it is near to the head, it is subcapital, then उसके नीचे transcervical, and the basicervical is just near to the GT. This is your anatomical classification of the neck of femur fracture. Now second is the Powell's classification based on the Powell's angle. और इसके में क्या होता है, Powell's angle क्या होता है, Powell's angle is angle between the fracture line. Okay, this is your fracture line here, and the horizontal line touching the superior border of the femur head. So this is your Powell's angle. And type 1, 2 and 3 जैसे जैसे ये angle बढ़ता जाएगा यानी fracture line नीचे होती जाएगी, and the more the angle यानी the more distal the fracture line, the more unstable is the fracture and worse is the prognosis. So Powell's classification. And third, this one is the Gardner's classification. What is this? This is your Gardner's classification, and this is according to the rotational displacement in case of fracture neck of femur. So ये important है किसके basis पर, this is your rotational displacement. This first one में क्या होगा, first one में the fracture will be incomplete and undisplaced, also called as impacted or the abducted fracture, and only this is the fracture of neck of femur which can be managed conservatively. Okay, only this is the femur fracture का, neck of femur fracture का type जो कि आप conservatively manage कर सकते हो. The second one is the fracture will be complete but it will be undisplaced. Now third and fourth में the fracture will be complete and displaced, but इसमें displacement कम होगा and इसमें displacement ज़्यादा होगा, और इसमें displacement इतना ज़्यादा होगा कि the head and the remaining neck will not be in contact with each other. So the head will be in the normal position inside the acetabular cavity. Very important. Okay, now neck of femur का जो treatment होता है in adults, you can go for corticocancellous screws like this, or you can go for the dynamic hip screws like this. And in the elderly you go for the hemiarthroplasty. Hemiarthroplasty is different than complete arthroplasty, that is the total hip replacement by कि इसमें आप सिर्फ और सिर्फ फीमर का हेड ही चेंज करते हो, the acetabulum is not changed, that's why it is called as hemiarthroplasty. Unipolar and bipolar two types के होते हैं, जिसमें से bipolar is your preferred choice because it allows the movement in the two planes. Okay, so very very important for the neck of femur fracture. This is your traction or the fracture table used generally in the femur fracture surgeries to give the traction. And this is your C-arm or the IITV image intensifier machine, which is the portable X-ray machines in the operation theaters, where you can get the real-time image of the thing that you are doing inside the operation theater. And neck of femur के लिए पुराने ज़माने में there was this osteotomy जिसमें the proximal segment would sit upon the distal fragment like this, and this is से name आपके लिए important है. This is McMurray's osteotomy. Okay, this is called as the McMurray's osteotomy for the neck of femur. And और कौन सी osteotomy पढ़ी थी अपन ने? French osteotomy. French osteotomy is done in malunited supracondylar humerus fracture in gunstock deformity or the cubitus varus deformity. And एक और osteotomy पढ़ी थी, that was Salter's osteotomy. ओके, Salter's osteotomy किस में होती है? Salter's osteotomy is done in congenital dislocation of the hip. And एक और osteotomy पढ़ी थी, that was Dewey's osteotomy, and this Dewey's osteotomy was done in CTEV. ओके, सो ये डिफरेंट टाइप्स ऑफ ऑस्टियोटमी होती है, नाम से आती है. ये चार तो एटलीस्ट आपको याद होनी चाहिए. द मैकमरेज ऑस्टियोटमी फॉर द नेक ऑफ फीमर, French osteotomy for the cubitus varus deformity in malunited supracondylar humerus fractures, Salter's osteotomy in congenital dislocation of the hip, and Dewey's osteotomy in CTEV. Okay, very important, CTEV or clubfoot. Okay, now you need to remember this. Okay, इसके बाद the Hamilton Russell traction which was used before for the management of the IT femur fracture, but now it is not used. You can see in the image कि कितना cumbersome procedure है. So just remember the name कि ये it is the Hamilton Russell traction. Okay, and it looks like this. Now the IT femur fracture, if it is undisplaced, it can be managed conservatively by traction alone and then the physiotherapy. And if it is displaced, then you have to go for the surgical correction, and the treatment of choice is close reduction, internal fixation by nailing. And here the nail used is the PFN, that is the proximal femur nail, very important. Plating and all भी आप कर सकते हो, DHS भी कर सकते हो, but the treatment of choice is the nailing in case of displaced fracture. Now normally the angle between neck of the femur and shaft of the femur is between 120 to 140 degrees in the adult. Okay, and if it is decreased, it is called as coxa vara, and if it is increased, it is called as coxa valga. And congenital coxa vara is seen in association with congenital dislocation of the hip. और इसमें क्या होता है, जो children होते हैं, in child normally this angle is not 120, it is 160. So if it is in child, if the angle is 120, then it is not normal, it is decreased, और इसको क्या बोला जाता है? कॉक्सा वेरा बोला जाता है. तो ढंग से क्वेश्चन पढ़ना है कि एडल्ट है क्वेश्चन में या चिल्ड्रन है क्वेश्चन में, उसके हिसाब से द आंसर विल चेंज. ओके, रिमेंबर दिस थिंग. Now we'll come to the fracture shaft of the femur. This is also a prototype fracture. Means prototype fracture क्यों बोलते हैं? Because ट्रांसवर्स, ओब्लिक, स्पाइरल, कॉम्यूटेड, है ना, हर तरह का फ्रैक्चर हो सकता है. एंड इसमें यू नीड टू टेक केयर ऑफ टू थिंग्स, दैट इज फर्स्ट इज योर हीमोडायनामिक्स, बिकॉज देयर इज very large blood loss here, and the second you have to check about the fat embolism. If it is undisplaced, which is very unlikely, क्योंकि fracture shaft of femur are mostly displaced because there are lots of muscles attached to it, and due to the pull of these muscles they get displaced. So these are mostly displaced, and if they are displaced, what is the treatment of choice? In adult, you go for the interlocking nail of the femur. This is your treatment of choice. And in children, you go for the Anders nail or the tense nail. But if the child is less than 5 years of the age, now you go for the conservative management, because the reduction is easy. Okay, reduction is easy and there is high chances of remodeling. Okay, so what कैसे करते हैं? It is done with hip spica. एंड पुराने ज़माने में एक ट्रैक्शन यूज होता था जो अब यूज नहीं होता है, बिकॉज इट इज़ वेरी कम्बरसम. यू हैव टू जस्ट रिमेंबर द नेम. इन लेस देन 2 years ऑफ एज के बच्चों में यू कैन यूज a gallows traction for fracture shaft of femur. Very important, gallows traction. Okay, so this is your shaft of femur fracture post-op x-ray, where you can see the interlocking nail in situ. Okay, this is your fracture shaft of femur and it is healed like this. Okay, you can also go for the plating. This is your tense nail or the Anders nail, which is used in children. Okay, and now femur mein you can have the supracondylar fractures above the condyle. You can have the unicondylar medial condyle or the lateral condyle ka fracture, or also you can have the intercondylar fracture. And in sab mein hi the treatment of choice is surgery by the plating if they are displaced. Okay, and अगर इंट्रा आर्टिकुलर है then you have to correct it by the surgery, because you need a precise reduction, otherwise the joint will go into the osteoarthritis. Now Hoffa's fracture, very important for your question point of view. It is fracture of lateral condyle of femur. ओके, एंड इसकी खास बात ये होती है कि इन AP view it is not appreciable very easily, but in lateral and the PA view you can see the fracture easily. So this is your Hoffa's fracture, fracture of lateral condyle of femur. Okay, now we'll come to the fracture of patella. Here you can see patella के लिए you have a different kind of view which is called as the skyline view. Okay, skyline view. And कोई आपसे पूछे what is this? It is a PA view. Okay, skyline view is a PA view. Here you can see patella and this is your femur. Okay, and you do the skyline view like this. Just remember the image की prone position में लेटा के with flexed knee you expose the x-ray beams like this. Okay, so patella पे चलने से पहले patella is responsible for the extensor mechanism of the knee, and it is due to the quadriceps femoris. Okay, it is due to the quadriceps femoris muscle. ऊपर the quadriceps femoris tendon attaches with the femur. नीचे patella के नीचे there are two patellar retinaculum, and this patella is attached to the tibia with the help of the patellar tendon, and this is your extensor mechanism. अब आपको जो चीज याद रखनी है वो ये रखनी है कि in any case of patellar fracture, if you are going for the surgery, then whether कोई सी भी सर्जरी हो, be it tension band wiring, TBW or the patelectomy, in every partial or complete any type of patelectomy you have to repair this extensor mechanism and you have to repair the retinaculum. It is very important, इसको याद रखना है. And also if the fracture is or undisplaced, you can manage it conservatively by a special slab जो patella के अंदर यूज होती है. It is called as the cylindrical slab. Okay, and if it is multiple parts of stellate fracture or displaced fracture, you have to go for the surgery. और अगर the fracture segments can be united, so they can be reduced with the help of tension band wiring. And if बहुत से छोटे छोटे pieces है and it is not able, and if you are not able to reduce them and fix them using any implant, then you can go for the partial or the complete patelectomy. Okay, important. अब एक important चीज जो आपको याद रखनी है, tension band wiring are used in generally in 3 fractures of the body. Okay, कौन कौन से 3 fracture में ये use होती है? Firstly, we have discussed the patella, in the olecranon fracture, and in the fracture of the medial malleolus. Okay, these two are more important. This is your tension band wiring. Okay, here you can see TBW in case of fracture of the patella. Okay, now we'll discuss about the patellar dislocation also. They are important. So patellar dislocation जो होता है, they are of 3 types. First is the acute, second is the recurrent, and the third is the habitual. Okay, 3 types of patellar dislocations. Acute नाम से पता चल रहा है acute injury की वजह से होगी. Generally if there is any trauma to the flexed knee. Okay, and patellar dislocations generally they are lateral direction में patellar dislocation होता है. Patellar dislocations are in the lateral direction and extensor mechanism is lost. So यहाँ पे what you do, you will reduce the patella. What is recurrent and then maintenance? What is recurrent? Recurrent is if more than 1 बार हो गया है patellar dislocation, generally in the adolescent population के अंदर होता है. And habitual is every time you flex the knee, the dislocation occurs. So for these two you go for the surgery, and the surgery में what you do, you repair the medial patellofemoral ligament, which is nothing but an extension of quadriceps tendon only. So medial patellofemoral ligament का reconstruction करना पड़ता है. And इस operation का एक unique name है, that you just need to remember the name of this operation, and this operation is called as Hauser's operation. This is called as Hauser's operation. Important. Okay, this was, and now this here you can see proximal tibia and इस articular surface को involve कर रहा है of the knee. So this is called as fracture of tibial spine और दी टिबियल प्लेट्यू, नॉट स्पाइन, टिबियल प्लेट्यू के फ्रैक्चर्स बोलते हैं. एंड अगर इसका फ्रैक्चर है देन इट इज कॉल्ड एज द टिबियल स्पाइन. एंड टिबियल प्लेट्यू फ्रैक्चर्स होते हैं. सो इसमें आपको वही ट्रीटमेंट है, अनडिस्प्लेस्ड है तो कंजर्वेटिव, नहीं तो सर्जरी बाय द प्लेटिंग. एंड इंट्रा आर्टिकुलर होते हैं तो यू नीड द प्रिसाइज रिडक्शन, सो मोस्टली यू गो फॉर द सर्जरी. एंड इसमें यू नीड टू रिमेंबर इट्स क्लासिफिकेशन, एंड इट्स क्लासिफिकेशन इज called as Skadsgar classification, and it is divided into 6 parts. बस आपको नाम याद रखना है, that is your Skadsgar classification. Okay, अब एक चीज जो आपको और याद रखनी है कि if there is fracture of tibial spine, so with fracture of tibial spine almost always, most commonly you have injury of ACL associated with it. Okay, ACL की injury is almost always, anterior cruciate ligament injury is almost always associated with the tibial spine fracture. Okay, now this is your patellar dislocation. Here you can see laterally it is dislocated. Okay, and patellar dislocation में एक important चीज आती है, that is your Insel-Salvati ratio or the index. Okay, it is the ratio between the height of the patellar tendon and the height of the patella, and normally it is 1. Okay, and it is used to determine the patellar height, and it is usually 1. अगर Insel-Salvati ratio 1 से ज़्यादा है, means the patella is high seated or patella is displaced towards the femur, and this is called as the patella alta. और अगर नीचे टिबिया की तरफ है देन इंसल सलवर्ती रेशियो इज लेस एंड इट इज कॉल्ड एज द पटेला बाजा. Okay, it is called as the patella baja. And remember, the recurrent or the habitual dislocations are more common in case of patella alta. Patella alta में the recurrent or the habitual patellar dislocations are more common. Very important. Okay, here you can see the fracture of tibia. So सबसे पहले fibula. So fibula का fracture is managed conservatively because ये functional bone नहीं होती है except its distal fibular fracture which is involved with the formation of the ankle mortise. Important. Now tibia की खास बात ये होती है, सबसे पहले it is a subcutaneous bone. You can feel it in the shin bone आराम से. So they have high chances of association with the open or fractures or compound fractures or large lacerated wound. And एक और बात है कि distal 1/3 tibial fractures have high chances of non-union because there is precarious blood supply and there is very less blood supply because नीचे सारे muscles are converted into the tendons for the attachment. Okay, so यहाँ पे surgeries are very risky because of high chances of non-union as well as high chances of infection. Okay, so ये आपको ध्यान में रखना है. This is very important. बस इतना ही important है. And the treatment of choice depends on the type of the fracture. If it is undisplaced, it can be managed conservatively with the GT, greater trochanteric slab, then cast. If it is displaced, then you have to go for the surgery. And the treatment of choice is your, like in the femur ILN, interlocking nail of tibia. In the image you can see fracture of the tibia. This is a commutated fracture. Okay, नाम से ही पता चल रहा है. नाम से क्या, इमेज से पता चल रहा है. इन द एक्सरे दिस इज योर कम्यूटेटेड फ्रैक्चर एंड दिस इज योर इंटरलॉकिंग नेल ऑफ टिबिया. दिस इज योर इंटरलॉकिंग नेल ऑफ टिबिया. ओके, सो now we'll come to the ankle series. Ankle series is important and इसमें क्या होता है, firstly you have to learn about the ankle mortise, and to see the ankle mortise you need to do the mortise view. Now what is mortise view? It is an AP view, anterior posterior view, with foot in 15 degrees internal rotation. 15 degrees, foot or ankle in the 15 degrees internal rotation. This is your ankle mortise. See, AP में the entire joint line is not visible and also the tibiofibular syndesmosis is not visible. In the mortise view you can visualize it completely. This is your mortise view. And remember, कोई सी भी ankle injury हो, your aim is to maintain this mortise view और वापस से normal mortise, ankle mortise बनाना. This is your aim in any type of ankle injury. Remember this thing. Okay, now ankle injuries में you have a classification based on the, it is based on the cause of the injury या injury होते time what is your location of the knee, और कि रोटेशन में है, इन्वर्जन में है, एक्सटर्नल रोटेशन में होके इंजरीज हुई है, किस में इंजरीज हुई है, बेस्ड ऑन द मैकेनिज्म ऑफ द इंजरी. एंड यू जस्ट नीड टू रिमेंबर द नेम, एंड द नेम इज log Hansen classification. Okay, and the name is the log Hansen classification. Remember the name. अब इसमें फर्स्ट इज योर अडक्शन इंजरी, जिसमें अडक्शन या इन्वर्जन होता है. सो अडक्शन या इन्वर्जन दो तरीके से हो सकता है, इन अ प्लांटर फ्लेक्स्ड फुट और इन न्यूट्रल और द डॉर्सीफ्लेक्स्ड फुट. ओके, सो अगर ये प्लांट सी इन जनरल द इन्वर्जन इंजरीज आर most common. The inversion injuries are the most common injuries, and you can see अगर inversion होगा like this, the inversion, then the force or the tension is in the lateral direction, yani in the lateral collateral ligament, so the injury will be in the lateral collateral ligament, very important. And eversion में इसका उल्टा हो जाएगा. So in plantar flex the lateral collateral ligament में इंजरी होगी, बट इन्वर्जन न्यूट्रल या डॉर्सीफ्लेक्स लेग में इन्वर्जन करोगे देन देयर इज एसोसिएटेड फ्रैक्चर ऑफ मीडियल मेल्युलाई, वेरी इंपॉर्टेंट. अगर अबडक्शन या इवर्जन के अंदर इंजरी होगी, दैट इज टाइप second type, then your medial collateral ligament, also called as the deltoid ligament, will be injured. Okay, now the third is your external rotation injury with pronation. Okay, pronation, external rotation injury. So इसमें आपको क्या याद रखना है, pronation external rotation injury में there will be disruption of the tibiofibular syndesmosis. There will be disruption of the tibiofibular syndesmosis, and if there is associated fracture of neck of fibula with this, then this is called as the Masoni's fracture. Here you can see in this image, this is your Masoni's fracture. This is a pronation external rotation injury of the ankle, where you can see ankle mortise is lost and there is disruption of tibialofibular syndesmosis with fracture of neck of femur. This is called as Masoni's fracture. Okay, now the fourth type is the supination external rotation injury. अब इसमें आपको ये ध्यान रखना है, the tibiofibular syndesmosis will be normal. Tibiofibular syndesmosis, here it will be normal. Here there will be dislocation of the talus. Okay, very important, there will be dislocation of the talus in case of external rotation injuries with supination. Okay, now there are three malleoli in the ankle: the lateral malleoli of the fibula, the medial malleoli of the tibia, and the posterior malleoli of the tibia. So if it is bimalleolar fracture, yani two malleoli are fractured, this is called as the Pott's ankle. And if the fracture is trimalleolar, as in the X-ray here, it is called as Cotton's fracture. Okay, then it is called as Cotton's fracture, very important. Okay, remember this. Now last type is your vertical compression injuries, and इसमें भी एक special type of fracture मिलता है, that is your Pilon's fracture. Now what is Pilon's fracture? Pilon's fracture is the intra-articular fracture of distal tibia plus fibula. This is your Pilon's fracture in case of vertical compression forces on the ankle. Okay, ये भी आपको याद रखना है नाम से, the Pilon fracture. Okay, now this is your fracture of the talus, and most commonly it occurs in the neck, and it has high chances of avian due to its precarious blood supply, and it is the only bone in the foot or the lower limb which have no muscle attachment. With no muscle attachment, and it is most commonly seen during the aircraft crash, so it is also called as the aviator fracture. It is also called as the aviator fracture, very important. Here you can see this is your aviator fracture, that is fracture of talus. Okay, aviator fracture, that is fracture of talus. यहाँ पे फिफ्थ मेटाटार्सल का बेस का अगर फ्रैक्चर है, this is called your zones fracture, and it is displaced due to the pull of which muscle? Due to the pull of peroneus brevis muscle, remember. लेकिन अगर यहाँ पे फ्रैक्चर होगा, it is called as the pseudo zones fracture. Okay, it is called as the pseudo zones fracture, remember this. Now दिस इज योर नॉर्मल पार्ट्स ऑफ द कैल्केनियम. सो कैल्केनियम में ये जो पार्ट होता है पोस्टीरियरली एंड पीछे की तरफ द प्रोमिनेंट पार्ट, दिस इज कॉल्ड एज योर ट्यूबर कैल्केनाई. ये आपको याद होना चाहिए. एंड इन कैल्केनियम यू हैव डिफरेंट टाइप्स ऑफ एंगल. दिस इज योर बोलर एंगल. जस्ट रिमेंबर बोलर एंगल कैल्केनियम के साथ एसोसिएटेड होता है बिटवीन कैल्केनियम एंड टेलस. एंड एक और एंगल होता है दैट इज योर टेलो calcaneal angle and it is called as the Kite's angle. Normally it is 35 degrees and it is decreased in case of CTEV. And the third one is called as the critical angle or the Gissen's angle. Ki why it is critical? Because it decides whether the fracture of the calcaneum is operatable or the indication is operative or not, called as the Gissen's angle. And it is the in the this subtalar joint. अगर this subtalar joint में ये angle is increased, okay, or there is displacement, then you have to go for the surgery. बस इतना सा ही आपको ध्यान रखना है. The calcaneum fractures are called as the Lever's fracture or the Casanova fracture or the Don Juan fracture. Okay, very important. ये नेम से आपके आ सकता है. एंड दिस कैन बी एक्स्ट्रा आर्टिकुलर एज वेल एज इंट्रा आर्टिकुलर फ्रैक्चर ऑफ द कैल्केनियम. कैल्केनियम अपने हील वाली जो बोन होती है दैट इज योर कैल्केनियम. ओके, नाउ व्हाट इज नट क्रैकर फ्रैक्चर? नट क्रैकर फ्रैक्चर में आपको बेसिकली ये याद रखना है, इट इज फ्रैक्चर ऑफ क्यूबॉइड बोन with avulsion fracture or avulsion of a part of navicular. Okay, ये आपको याद रखना है. This is your nutcracker fracture, this is your navicular and this is your cuboid bone. So आपको इतना सा याद रखना है कि cuboid bone fracture है primarily with avulsion of the navicular bone. Okay, now this is your march fracture which is very important and very easy. ये तो सबको ही आता होगा. This is your stress or the fatigue fracture and generally it is fracture of the second or third metatarsal की shaft होती है. And these are very microscopic undisplaced fracture and which are not easily appreciable on the X-ray. You have to correlate clinically with the area of the tenderness and the swelling and the pain, and it is due to the chronic repetitive stress. Okay, can be managed conservatively. Here you can see it is healed fracture. Okay, this is your healed fracture. Okay, now this fracture, this is your very important for examination. This is your Lisfranc fracture. Okay, Lisfranc fracture generally क्या होता है? Lisfranc fracture is the metatarsal joint का disruption होता है. And here what you have, here you have second metatarsal base with medial cuneiform का disruption. And here एक इसी डायरेक्शन में, in this direction you have the Lisfranc ligament which is torn and it is always managed सर्जिकली. ओके, कभी भी इसको आप कंजर्वेटिवली मैनेज नहीं करते हो, हमेशा सर्जिकली यू नीड टू मैनेज दिस. दिस इज योर लिस्फ्रैंक फ्रैक्चर, वेरी इंपॉर्टेंट. ओके, नाउ नेक्स्ट इज दिस इज योर साइनस टारसाई. एंड इन एथलीट्स जिसमें ज़्यादा यूज होता है फुट का, सो देयर मे बी इन्फ्लेमेशन ऑफ दिस लीडिंग टू द साइनस टारसाई सिंड्रोम. बस आपको इतना सा ही याद रखना है, मैनेजमेंट इज कंजर्वेटिव, मैनेजमेंट इज conservative. Okay, this is your os trigonium which is a congenital new bone formation in the adolescent, ectopic bone formation in 7% of the adults. Okay, this what is this? This is your leg screws. leg screws क्या होता है? एक chip fracture जो होता है उसको reduce करने के लिए you put this leg screw. so सिर्फ एक्सरे में आइडेंटिफाई आपको करना आना चाहिए कि what is this? This is your leg screw. what is this? This is your Elizarov technique which is a boon to the orthopedics, where you provide the normal biological environment, so that जो नॉन यूनियन या माल यूनियन है या फिर जो बोन लॉस है, ड्यू टू द कंप्रेसिव एंड द डिस्ट्रैक्शन फोर्सेस, यू कैन यूज दिस. ओके, हियर यू कैन सी, यहाँ पे देर इज माल यूनियन एंड देर इज लॉस ऑफ द नॉर्मल अलाइनमेंट, बट विद द इलिजारो ये नॉर्मल हो गया है. सो दिस इज योर इलिजारो, आइडेंटिफाई करना आना चाहिए. नाउ व्हाट इज दिस? दिस इज योर कॉन्जेनाइटल डिसलोकेशन ऑफ द हिप. ओके, सीन इन चिल्ड्रन, किसमें? फीमेल्स में दिखता है ड्यू टू रिलैक्सिन हार्मोन लेफ्ट साइड में, एंड फर्स्ट बॉर्न के अंदर होता है. एंड टिल 2 years of age द क्लोज रिडक्शन इज डन इजीली. बट अगर आपसे पूछे मैक्सिमम कब तक कर सकते हो, तो यूनिलेटरल केस में टिल 10 years, and bilateral केस में till 8 years. and what is the treatment of choice? reduce करो and then maintain it by traction or the hip spica, mainly by the hip spica. and इसमें आप use the rosin Vaughan splint and the rosin Vaughan view. what is rosin Vaughan view? क्या होता है? इफ यू हैव abducted और एक्सटर्नली रोटेशन के अंदर आप करते हो, सो द लाइन फ्रॉम द लॉन्ग एक्सिस ऑफ द शाफ्ट ऑफ द फीमर, नॉर्मली इट इन एक्सटर्नली रोटेटेड, यहाँ पे नहीं, इट goes past the acetabulum, it pierces the acetabulum, but in CDH it is not possible. okay, तो CDH में क्या होता है, जो एसिटाबुलम लैब्रम होता है, इसको बोलते हैं लिम्बस. सो दैट इज inverted because there is fibrofatty tissue that is in this acetabulum, and there is break in the Shenton's line. okay, Shenton's line जो होती है, या मीडियल साइड में लेसर ट्रोकेंटर से सुपीरियर प्यूबिक रेमाई तक एक लाइन होती है, दिस इज कॉल्ड अ Shenton's line. it is breaked, there is shallow acetabulum, there is shallow acetabulum here. okay, now this is your congenital pseudoarthrosis of the tibia. ऐसा डिफॉर्मिटी हो जाता है, and here you have the non union. so आपको याद रहना चाहिए by the x-ray and the photo कि ये क्या है. okay, so this was जल्दी से a rapid revision of the lower limb x-rays. okay, now today 9 p.m. I am having a special session with Dr. Muskan. That is the last minute tips and tricks to crack NEET PG, and it will be a short, only 30-minute session. ज़्यादा time नहीं लेंगे. Please do watch it on the YouTube live. and tomorrow at 7:30 p.m. we'll discuss the remaining x-rays of the upper limb, as well as the x-rays of the bone tumors, osteomyelitis, etc. and it will be a special class. for that you just need to download the app and use this code for the subscription, both of which are absolutely free. okay, so I hope you like the videos, and I hope you are studying well. बीमार मत हो जाना लास्ट टाइम पे, अच्छे से सोना, अच्छे से खाना, टेंशन मत लेना. बस यही सोचना कि लास्ट 5 days are left, then I'm free, I can do party or I can go for a tour, etc. okay, so think like this. and if you like the video,